Okay, welcome everyone to today's event. My name is Scott from SciTrain, and on behalf of all of our friends and colleagues at Scifiniti Publishing, thank you so much for joining this event today. It's an exciting one. The topic is developing evidence synthesis skills, and our expert presenters are joining us here. First, I'd like to introduce you to Dr. Hasan. Dr. Hasan, thank you so much for making
Thank
time
you.
to lend your expertise today.
Thank you for inviting us.
It's my pleasure. It's my pleasure. On behalf of everyone at Scifinity and SciTrain, it's great to have you here. And also presenting today will be Sharanya. Hello. Nice to meet you.
Hello, same, it's good. Thank you for inviting.
My pleasure. I'll leave our guests to our expert presenters here in just a moment. If you're joining us for the first time, then welcome. This is a series of events that Scifinity and SciTrain have been hosting together for some time, and it's always a pleasure for us. And sometimes we do general events, but tonight is an example of one of our journal-focused events, and we're very excited for this one. Hopefully, you're joining us for either to hear more about developing evidence synthesis skills, or you might also have an interest in the Evidence Synthesis in Healthcare Connect journal, which is offered by Scifinity Publishing. So either way, we'll post some links into the chat so you can find out more about the journal and about the good work that Dr. Hasan and colleagues are doing there. So without further ado, I'd like to turn you over to our expert presenters for today. Over to you, Dr. Hasan.
Thank you very much, Scott, for inviting and arranging this session. So we'll be talking about developing evidence synthesis skills, especially in healthcare settings. So I'm Dr. Hasan. I'm the editor-in-chief of Evidence Synthesis in Healthcare Connect, one of the Scifinity journals, focusing on evidence synthesis, systematic reviews, all kind of systematic reviews and meta-analysis. So I'm also a reader or associate professor at University of Huddersfield in pharmacy department. My main focus in research is on quantitative and qualitative synthesis, evidence synthesis, methodological approaches in evidence synthesis, and also looking at the drug utilizations and health services research. So in this session, the objectives is to describe the evidence synthesis and its current status in healthcare, to discuss the value of evidence synthesis and ways to maintain quality in evidence synthesis, especially in the era of artificial intelligence, and also to present the process of submitting a systematic review in evidence synthesis and Healthcare Connect, where Sharanya will share her experience as well. She published her systematic review in our journal, Evidence Synthesis in Healthcare, on H. pylori. So she will discuss her experience as well with us, publishing with us, and to discuss the idea of evidence synthesis and future direction. And the last part is question and answers. I love to hear questions from your side, from the audience, and I would be happy to answer if there is any questions. As many of you are aware that in research, we deal with mainly two different type of research or research data. First one is the primary one or primary research, where we generate our own research data, where we conduct and collect and observe the first-hand experience or experimental data or research data in our research. But this is not possible in all cases due to many barriers and the resources available. So the next option is the secondary data or the secondary research, where we can collect the information published by the another researchers or is readily available from the other sources. So we can synthesize the evidence, which is mainly used in development of clinical guidelines or clinical summaries. They use this secondary research data where you don't need any ethics approval or any permission to use or collect the information. Is available online, and you can collect systematically and you can use it in your research to answer your research questions. So evidence synthesis and why we need it. So evidence synthesis is a process of bringing together the information from a range of sources and discipline to inform the debates and decision on specific issues. So we are not relying on one or two articles, but a series of articles, relevant and similar articles, not different articles, but similar articles on similar topic or same topic. And then we come up with a summary or overall effect or information from the article. So this helps determine how effective a certain treatment in case of a drug or a service or intervention in case of any new intervention that you want to collect the information and you want to conclude whether the intervention is effective or the treatment is effective, how the treatment are different in different population. So we can use this skill, the evidence synthesis, to combine and reach the overall conclusion about any health intervention, about any health treatment. So there are different types in evidence synthesis. There are 14 different types. If you look at the literature based on the published information, there are at least 14 different types. But I have listed here the most commonly used types of review or evidence synthesis. First one is the critical review. Critical review is not a systematic process of conducting evidence synthesis, but it's looking at the specific drug or a specific intervention and using selected references. So you don't cover the whole range of evidence, but you rely on specific relevant updated references and you write a critical review on that. And you sometimes you also add your expert opinion in that piece, and you critically appraise the selected references. Then the next type, the most commonly used, is the literature review or narrative review. It's a broad and the summaries. It summarizes the existing references, especially master's students and the PhD students. They do it in their thesis and dissertations. So they include as many articles as possible in their draft thesis, in their final thesis, and then they keep updating to a point of submission. So it's widely used. There is no structure in literature review or narrative review. You define your own structure in narrative review, and there is no checklist available, for narrative review or literature review. The next one is the scoping review. There is a checklist now available for scoping review, and there is a Prisma flow diagram as well for scoping reviews. So again, there is no boundaries. You gather as much evidence as possible. And what you do in case of scoping review, you do mapping of evidence and you present the discovered evidence into themes. So you do some kind of thematic analysis in scoping review. In case of narrative review, there is no mapping, there is no thematic analysis, but in scoping review, you collect a large body of evidence and the information, and then you present into different themes. The last one is the systematic review. It's the most widely used, method in evidence synthesis. Systematic review, which answers a defined and a refined question by gathering and summarizing all relevant evidence using a predefined eligibility criteria. So the difference between systematic review and scoping review is the presence of inclusion and exclusion criteria. So before you start searching for the information or the article, you would predefine your inclusion and exclusion criteria. So what articles you're going to include, what population you're going to include, what drugs or intervention you're going to focus on, and what outcomes you are going to include in your systematic review. So it's a scientific method, and you define your search criteria as well. You register your protocol as well with Prospero. Now is a requirement for many big journals. They ask you to register your protocol as well, and protocol is a very detailed proposal sort of thing where you define your research question, you define your keywords and your search terms, you define your searching criteria, and also you list down the outcomes you're going to include, the variables, the analysis method. If there is a meta-analysis, then you would talk about the methods of meta-analysis as well. So it's now widely used systematic review to synthesize the evidence on various topics. If you look at the growth of evidence synthesis, it's particularly systematic reviews and meta-analysis has been substantial over the past 3 decades, especially from 1992 onwards, when Cochrane Collaboration Center was established in 1992. Before 1992, if you look at the numbers, were very little. And if you look at 1990s, there were only 50 systematic reviews were published annually in PubMed. And by 2022, approximately 36,000 systematic reviews were published annually. So that is about 720 times increase, from the original value of 1990s or 72,000 in terms of percentage. So there's a substantial increase in the number of systematic reviews published in only indexed in PubMed. And this increase is even more noticeable when viewed in terms of daily publication rates. So estimates suggest that approximately 4 systematic reviews were published per day around the year 2000. And after about 10 years in 2010, it was 14 systematic reviews per day and reaching to 80 per day in 2019. So there's a huge increase from 4 systematic reviews to 80 per day. And the most recent analysis, I expected the number. And based on these numbers, the systematic reviews increased from 31,000 or almost 32,000 in 2018 to 61,000 in 2022. Mainly during the COVID period, there was a lot of focus on systematic reviews during 3-4 years from 2020 to 2022, 2023. There was a lot of people published systematic reviews when original studies were difficult to conduct because of a lot of policies, government policies, and restrictions. So there is a lot of focus on systematic reviews, and you see there is a significant increase in the numbers of systematic reviews. So now approximately, if you calculate per day, is 128 systematic reviews published per day. So that's a lot. So increase from 4 to 14 in 2010, then to 80 per day in 2019, and the most recent figure 2022 is 128. So by 2026 is about 160 to 170 systematic reviews per day. So this is a lot. So this unprecedented growth reflects the increasing recognition of evidence synthesis as a critical component of healthcare research, policy development, and decision making. So our journal, which focuses on evidence synthesis, provides a platform for high quality research. Because if you look at the number of systematic reviews, there is a substantial increase. And if you read many systematic reviews, you will find very problematic areas where you don't find the quality, you don't find, and then a lot of people, they reproduce the systematic reviews. There's somebody already published few years ago, and then they reproduce the same systematic review without changing the searching criteria or the inclusion or exclusion criteria. So there's a lot of repetition as well, redundant information available because of the skills are now widely used by researchers. So you see the significant increase in the number. So we are providing this platform to make sure that we are producing high quality research to inform clinical decision making and health policy across global healthcare landscape. We accept all types of evidence synthesis, including original research, only if they include a section on literature review. There is a section where they synthesize some sort of evidence as well. And we are committed to promoting transparency. We give, a fair chance to everyone when they submit their papers to us, and equity in healthcare research. So now I want to invite Saranya to share, because I want to, I invited Saranya to share her experience with us, because she was the first one who published, the systematic review with our journal, looking at the prevalence of Helicobacter pylori infection in India. Saranya?
Hello, everyone. So I'm Sharanya. I'm a PhD student and I'm a pharmacist. So today I'm here to share my experience of publishing my first systematic review and meta-analysis in this Journal of Evidence Synthesis in Healthcare Connect. So I shortlisted this journal because this is a relevant journal and my work was aligned with this journal scope, and they publish open access papers without a fee. So that's how I shortlisted this journal. And in today's presentation, I would like to talk more about the process of doing the systematic review, like how I conducted the systematic review and how I made sure the quality and standards are met throughout the procedure. So the discussion will be about that process. So to begin with, So, how to start a systematic review? So, just like for any kind of research, for systematic review, also start with a well defined research question like what we are going to do, what we are doing. So, in my systematic review, my topic was to estimate the prevalence of H. pylori infection in India among adults and children with and without gastrointestinal disorder. So, this was the topic of or the question for my systematic review. So, and as Dr. Shaz has already mentioned, it is when we are doing a systematic review, the first and foremost thing to do is to get a Prospero registration. So, Prospero is an international database where we can register our protocol, and they will review your application and they will provide a Prospero reference ID. And this reference ID is really important to get our work published in any good quality journals like this. So, to get the Prospero registration, we have to provide few details about the systematic review. It's like a proposal, how we are going to conduct the systematic review. So the details we have to provide include the review title and objective, the research questions and eligibility criteria, and search strategy, what strategy we are going to use, and outcome of interest, and method of study selection, data extraction, quality assessment, and planned data synthesis and analysis, how we are going to analyze and how we are going to synthesize the data. So all this detail has to submit before starting the actual systematic review to get the Prospera registration. And so the next thing is like why journals enforce Prospera registration, like advantages of getting a Prospera registration. So this always promote transparency because we are registering the proposal beforehand, so it always promote the transparency and it reduces duplication. As Shazad was mentioning, now lots of duplicates are happening, so it will reduce duplication. So whenever we are starting a systematic review, we can always have a check in the database if any similar work is already been registered, so it avoid duplication and it avoid reporting bias because we already registered the protocol, and then we have to stick to the protocol that we have submitted, or we have to provide clear justification if any deviation happen from the registered protocol. So it always avoid reporting bias and it improve methodological quality because we are providing a detailed protocol. So always improve the methodological quality, enhances credibility, and facilitates peer review. So these are the advantages of getting a Prospera registration. So next, moving to the methods, these are the methods that I followed. So I did a research search for the studies in three databases, Medline, Cinehill, and Google Scholar. So I used these three databases to do the search for my studies. And the search terms used were Helicobacter pylori or H. pylori, prevalence or incidence or epidemiology or frequency or occurrence or statistics, and India. And the time period was January 2000 to 31st December 2024. This was the time period. Um, and This was the inclusion and exclusion criteria for the studies that I'm going to include in the systematic review. So we included all original studies like cross-sectional studies, case control, any kind of original studies were included, and studies conducted in people with or without gastrointestinal disorders was included, and studies conducted among any age group were included, and any studies detected H. pylori using any recognized test, diagnostic test were included. And we excluded all non-original studies like commentaries, reviews, and editorials. And we excluded all article published in other languages other than English languages were excluded. And studies conducted in non-Indians or Indians residing in abroad were also excluded. Next is validation of data extraction. So after an extensive search in all the database and after the screening, we ended up having 52 studies to include in the systematic review. So once we have the final group of studies to include in the systematic review, the next step is to extract the required data from each studies. So that we retrieved the data and we entered into a Microsoft Excel spreadsheet, and this information was validated by a second reviewer. So the data I extracted from each studies were the specific region where the study was conducted, and the population age range, and any concurrent disorders was reported, was the patient was symptomatic or asymptomatic, and overall participant count, the study design, method used to detect H. pylori, and any details about the treatment provided. So all these details was extracted from each of the included studies and entered into a Microsoft Excel spreadsheet. And the next thing was the quality assessment. So we did a quality assessment for all the included studies, all the 52 studies. We did a quality assessment, and for that we used NOI scale, modified to using cross-sectional case control or cohort studies. Because all the 52 studies fell into any of these research categories, so we used NOI scale, and this process was also checked and validated by another reviewer. And next, study outcomes and statistical analysis. Because this was my first systematic review, this journal's feedback helped me really to write properly the methods and the statistical approaches I have used. Uh, the journal emphasizes to define all outcomes in methods, and also we have to describe all the statistical methods and approaches we used when doing the meta-analysis. So in this systematic review, for people with no GI disorder, we identified a pooled point prevalence, whereas for patient or people with GI disorder, because the heterogeneity among the data was so large, so we did a subgroup analysis. We find out the prevalence among people with each condition, like gastric cancer, dyspepsia, and ulcer. So we did separate analysis for each condition. And the journal's reviewer feedback was to give definition for each of the subgroup, because that will give more clarity to the readers when they read our work. So I provided the definition for gastric cancer. It was defined as the development of malignant cells in stomach lining, and dyspepsia, as referred as indigestion, was defined as a discomfort in the upper abdomen, including symptoms such as abdominal pain and early satiety. So this was the definition given for each subgroup. Next, presenting to the findings. So this is really important to provide an updated Prisma flow diagram. Journal ensures that we have a Prisma flow diagram when we submit our manuscript. So this actually gives the reader an idea how we did the search and how we screened the article, screened the published paper, and ended up having the studies included in the systematic review. Here, you can see that the database, how many studies were identified from each database, and how I screened how many studies were duplicates were there, and how many studies excluded after heading, abstract, and full reading, and the reason for exclusion after reading full text. So, and at last, 52 studies were included. And the next thing is the journal's instructions about the figures were really clear. So they was very particular about presenting the findings in a proper way. So I use the forest plot to present the national prevalence and the subgroup prevalence and prevalence in children and all. I use the this forest plot because this gives a quick visualization summary and the effective size of each included studies. So it provide a better understanding and interpretation of the findings. So we thought of presenting this in a forest plot. And next was the regional prevalence. So regional prevalence, this helped editors' feedback because they encouraged us to present the regional prevalence in a better way. So we were thinking and we thought of doing it in a map because it's a regional prevalence. So we presented the regional prevalence in this map. In this map, the darker the color, the higher the prevalence. That's how we presented this in the regional prevalence. And the gray areas indicating where no studies is being reported. So this is how the regional prevalence was reported. And next thing is, the final thing is to writing the report. So it is important to follow Prisma 2020 checklist when we write the report. This is really important and the journal ensures we follow it because we have to submit our Prisma 2020 checklist along with the manuscript when we submit this to the journal. This Prisma 2020 is an international reporting guidelines for systematic review. They have 27 checklist. In that checklist, they clearly mention what all things to be included in each section of the report, like how the title should be, what all things to include in introduction, what all things should be in the methods, like that. clear definitions, clear checklists are available. So we can always make sure the authors report every stage of the review transparently. So this is an international guidelines. And when we follow these Prisma guidelines, when we write the report, we can always improve the reproducibility and completeness of the research. So I would say, like, when we are new to systematic review, beginner in systematic review, it's always good to follow Prisma checklist throughout the procedure. Like when we are preparing the methodology, doing the data analysis, it's always good to have a look into Prisma checklist so that we can make sure that we are following the international guidelines. So in that way also it is good to have Prisma checklist in hand. So yeah, that's how I did my systematic review. Yeah, that was my experience with this journal. Thank you, Dr. Shahzad, for the opportunity. So
Thank you
thank you.
very much. Thank you, Sharanya, for sharing your experience. I would like to add 2 points here. One common mistake that we see in journal manuscript is in terms of the quality assessment. There are two types of assessment we do in systematic review. First is the related to methodology. So where you assess the quality, the methodological quality of the study or the review. So there are checklists available to evaluate the methodology or methodological approach used in the review paper. And there is another checklist which is for reporting quality. So a lot of authors, they mixed, they use reporting quality criteria to establish the methodological quality of the manuscript. So when you are choosing the criteria, the checklist for evaluating the methodology of your review, so you have to select the appropriate checklist and not the reporting criteria for methodology. So it's a common mistake we observe. And there is another story, interesting story regarding this systematic review. I mentioned about people repeating the systematic reviews. So I have done a lot of systematic reviews, and I don't want to hear people coming and telling me that you have done this systematic review, but somebody has already done it before 2 years ago or 3 years ago. I don't want to hear this. But when I received this manuscript, so as an editor, I know that I have to check the similar systematic reviews published in this area on this topic. So I found one systematic review published in 2017 on global prevalence of H. pylori. It was published in a very high impact factor journal, in gastroenterology. And they presented the global estimates, including India. India was included in that global estimate as well. And that, I just checked before this presentation, is already cited by 5,000. Citation is 5,000 for that global prevalence of, H. pylori. So when I was checking and I received this paper, I said, why they want to do this prevalence of H. pylori when the global estimates, including India, was already published. So I was doing the analysis. So I have to spend some time because I find there is a potential, and they followed all the checklist and the quality is really good. So when I checked the studies included from India in the global prevalence published in 2017, they included only two studies to estimate the prevalence of India, which is a very big country. And when I checked the year of publication, of the two studies included in the global prevalence paper, the first study was published in 1994. And the second study they included was published in 2000. And they are presenting the prevalence of H. pylori in India based on studies published in 1994 and 2000. So that's not the right approach in case of prevalence studies or prevalence meta-analysis or systematic review. So then I asked the authors to write a rationale, a paragraph discussing this. You can say, they have to justify why they are doing it. And then they have to explain that there is a global prevalence paper published a few years ago. They included and estimated the prevalence of H. pylori in India based on studies published in 1994 and 2000, which is 25 years ago or more than that. And they are presenting in 2018 or 2020, which is not appropriate. I will not say it's wrong, but it's not appropriate. And then, we justify that, and authors, they included a paragraph, they identify there is a gap, and then when if you are preparing any manuscript or you're doing prevalence systematic review, try to include more recent studies. And if you are including studies from 2000 or 20 years ago, 25 years ago, so it's better you put 5 years period from 2000 to 2005 and 2005 to 2010, so people, they can see the trend, you know rather than you estimated based on studies we published 20 or 30 years ago, and you are presenting or publishing in 2025 or 2026. So that's not the right approach. For evidence synthesis, coming back to this one, what we ensure in our journal, that evidence synthesis is not a descriptive list of papers or summaries of research without any critical thinking or identifying the problems or issues, or organized around the sources with each described in great detail, like they are not including all the relevant articles, especially in case of systematic reviews. If any reviewer, they identify that the authors, they have not done their searching properly or appropriately, and they have missed some important articles, so that's a red flag. So it's straight rejection for me, because when it shows that your searching criteria is not appropriate or was not appropriate, because you have missed some important studies in your systematic review, it means that's the backbone of your review paper. If your searching criteria and you missed important studies, it's not a good quality. So you have to make sure that you include all the relevant articles, and you cover everything. So again, evidence synthesis should not be an argument for the importance of what you are researching, with no contextualization of key issues. You're only highlighting, for example, in case of H. pylori, without giving a context. You are just focusing that there was a previous systematic review and there was a mistake and there was some issues with that, and you are addressing that issue, and you are only focusing on that, and you are not giving any context why H. pylori is relevant in case of India. So you have to give all the other factors as well contributing to H. pylori, for example, in India. So ideally, evidence synthesis, must be organized around ideas with an assessment of previous studies, including their strengths and weaknesses. There you can identify the gaps, and then you come up with your objectives to address those gaps and meet and bridge those gaps. So future direction, and now especially in case of AI, because there is a growing overt and covert use of AI that raises important questions about the future evidence synthesis. There are a lot of AI platforms that are available. You can give prompts, different prompts to to these platforms. They can synthesize the information for you. So why there is a need of this evidence synthesis when you can synthesize evidence with the help of AI? So from the editor's perspective, the responsible integration of AI is both an opportunity and a responsibility. All the big journals, they are not stopping authors from using AI. They are not stopping. What they want is the responsible use of the AI. So authors, they can use AI tools with appropriate disclosure. So first thing we need is, because I work with other journals as well, and especially as an editor-in-chief with evidence synthesis in healthcare, we receive a lot of manuscript, and it's not 100% accurate, but AI detection is sometimes 70%, 80%, 90%. So there is a widespread use of AI. So first thing that we want from authors is the disclosure, so that they disclose if they have used. So they put the disclosure statement in the manuscript, and this actually improves the efficiency, and we make sure that it's not compromising the critical thinking part and methodological rigor, intellectual contribution, or human oversight. So they have to put a statement if they have used AI for, especially in case of evidence synthesis. They can use even the platforms like Ryan. A lot of people, they used for searching, systematic searching of articles. This is AI enabled. So they are using even for the articles and helping authors to identify relevant articles. So AI should be used as a complement to the evidence synthesis process, not rather than replacing the human expertise. So a lot of people, they are using it. It's very common now in even in universities, in all the different disciplines, in clinical practice, even healthcare professionals in their daily practice, they are using AI platforms to find the answers. But the problem is the information they are getting, whether it's reliable or not. So they have to check the references or what sources they're using, to find the answers for their questions. So even in case of journals, they are facing a lot of this problem, and we have revised our authors guidelines as well, put a very clear statement regarding the AI use, and they have to disclose in case they have used AI. But we don't accept 80% or 100% AI uh, produced the manuscripts. So we checked each and every manuscript uh, before we send out for peer review. So conclusion, so researcher must continue to make methodological decisions, critically evaluate the evidence, interpret the findings in context, and ensure that conclusions accurately reflect the available data. The scientific value of evidence depends not only on efficiency. You can improve efficiency. You have used AI with very perfect method, with perfect the outputs in terms of research. But this whole process depends on judgment, expertise, and transparencies as well. So in our journal, we encourage and support authors to maintain transparencies and rigor and add some new knowledge to the literature. So that's a very important aspect, the adding new knowledge. At least the least you can do as an author is to add at least some new angle. So that's your product. So if you are using the same method or similar method, a similar topic, but when you're writing a discussion, so at least propose something new, for the implications for practice or research. At least you add something new, some new aspect, a new angle, new approaches. Some people, they use new techniques, new methods, new protocols, new drugs, new interventions. But it's not possible, to have new interventions in all the research or with all the authors, because sometimes they are not in that decision making process, they are not involved. So it's not possible for them to test and trial new interventions. So you can use this secondary research where you can at least propose something when you are concluding. Before you conclude your findings, you can at least propose some new mechanisms, new algorithms, you can give some new angles, new explanations, something new. And in our journal, our aim is to become the preferred. That's our aim, choice for authors of evidence synthesis research. Thank you very much. And if you have any question, I would be happy to answer.
Dr. Hasan, thank you so much for that fascinating talk. I've just invited our guests to post their questions into the chat or the Q&A panel. I'm sure they have questions. I know I have questions, but let's give our guests priorities. One of the great things about producing a series like this is I get to have access to interesting presenters such as yourself. So I'll leave my questions for a bit later. If anyone has questions, feel free. Don't be shy to post them. And I'm sure our panelists would love to hear your questions. While our guests are gearing up their courage to ask some questions to you both, I wanted to maybe just post a couple of very basic questions on behalf of my own graduate students who I'm sure would be interested to ask you some questions. So I'm imagining what my own students would ask you. If you don't mind, Dr. Hasan, I'll post a couple of very basic questions while our guests are getting their questions ready. So first, a couple of foundational questions, and I'm relatively new to systematic reviews, but when should someone choose to conduct a systematic review instead of doing primary research? Any thoughts on that, Dr. Hasan?
Yes, that's a very important question. So if you are like, for example, you are working in a clinical practice or clinical environment, and you are treating patients, and then you come up with a new treatment, a new drug, for example. So and then you're trying to look for the indication or the side effects, for example, of a particular drug. Then you go and check the textbooks, BNF, or the drug information handbook. Try to find the information about the side effects or any off-label use of particular drug. So first thing, you will look at the published literature, the textbooks, BNF. If you find the answer, then you don't need to do any proper research for that. So sometimes you don't find the answer, especially during COVID. A lot of people talking about the effective treatment for COVID infection, early treatment. So there was, a limited answer or limited information was available. So the first option, you look at the published literature. So, and in case of COVID, there was little or limited information was available. So people were looking at doing critical reviews. And then because of limited information, they decided to do clinical trials and randomized, controlled trials. They do original research. So it depends on the information. If information is available, published literature is there, you use evidence synthesis skills to synthesize the evidence. And if you find there is a limited information or there is no clear answer, then you plan the original research and you collect your own, information.
That's interesting. And a related question would be, you mentioned COVID. I know there were a lot of preprints that came out of the COVID era. I wonder, I can imagine my students asking, is it okay to include things like preprints, conference abstracts, so-called gray literature? How do you decide those kinds of inclusion or exclusion parameters?
There are a lot of, because people they're scared of these preprint because of the retraction. People, they just remove their records. It happens a lot of with RCTs in COVID time. They uploaded on preprint servers, and later they just delete their record from there. And a lot of people, they use the preprints to do systematic reviews and meta-analysis. So they have to retract as well, because the original authors, they remove their record from preprints, and then you have to change your conclusion as well. You have to inform the editors that there was some data now available that are not available, so we have to change and revisit our systematic review. So that's the one limitation. But a lot of authors now, researchers, they are promoting preprint servers. They are posting there because they have issues with journals, because journals, they are not accepting their papers because they feel that this is not right. And then a lot of them, they feel that they have to pay for certain journals, so they don't agree with that. And then because of that, they go and, I know many professors, they just go and upload their documents, very good papers, technically sound. They just go and upload on preprint servers for readers to read and to spread, their new methods or new techniques for the readers to know. Mixed opinion, I can say. Yes, many people, they support, but many people, because they want to publish in good journals, so they avoid.
From your own editorial, thank you for your answer, Dr. Hasan. And from your own editorial standpoint, would you suggest or recommend people to include things like preprints in their review, or would you recommend caution?
Caution, because in case of systematic review, even with the Prospero, I see, because a lot of people now checking daily, go and Prospero and check what is available, what I can do. If something is ongoing, they go, there is an opportunity, and I can do it. Before they publish, somebody else published it. So they go and quickly do that evidence synthesis. So there's a race going on. So when they publish even on Prospero, a lot of people, they go and copy their idea, your idea. And then you finish something in 6 months, somebody can finish in 3 months. So that's, in case original research, they cannot copy. Original research, because they have they need resources, they need patients, they need participants. And then they have to collect data. Ethics approval is required. Permission is required. For systematic review, you don't need any ethics approval. You don't need any permission. You can just go. If you have the skills, you can just replicate the same thing. So that's the problem with systematic review, is if you are uploading it on preprint servers, people will know there is an opportunity for them.
Okay. All right. So caution. Okay, thank you for your answer, Dr. Hasan. That's fascinating. I do have some questions coming in from our guests today. I'm eager to turn it over to people who are actually involved in in clinical medical research. I feel like an imposter from the social sciences. But here is our guest, Sabila, who asks, I hope I'm saying that correctly. Thank you, Dr. Syed, for this insightful overview. How does an author register a protocol with Prospero? Okay, you mentioned Prospero in your talk today. How does one register their protocol on Prospero,
It's
excuse me.
so it's same like on ResearchGate or LinkedIn, or you create your profile with some detail. They need your official email ID, the formal from university or from any organization, and then you create your account. And then there is an option of adding a new protocol. So when you click that, then it gives you all the different items under that. So this provided the space for each item, so you add the information. So it's very simple. You just create your account, you go to Prospero, and there are other platforms as well for registering the protocol. So you go create your account with your official ID, not the personal ID, but like Gmail. You use your university email ID, and then you create and start a new protocol, and then you can update as well. So they take about 3 days to 5 days to review your protocol. Once you complete and submit, they take 3 days to review. And then if they have any feedback or comments, they will ask you to revise, and then they publish. After you publish your protocol, you can, if you want to make any changes, then you have to request to make changes in your protocol. Sometimes we make some changes. We miss maybe a particular type of study design that you want to include later. So you can go and make some changes as well. And make sure when you register, a lot of people, they just, if you check, there's ongoing for last 5 years. A lot of authors, they don't go back and update their record. They register, they get the ID, registration ID, and then they just forget. So you have to register, make the changes. When you complete all the stages, and when you publish, go and update your record as well. Because you see thousands of protocols on Prospero ongoing for last 10 years, 15 years.
Okay, great. Thank you so much for your answer, Dr. Hasan. And I hope that answers your question, Sabila. If we were not able to answer your question satisfactorily, then please just let us know and we'll get an answer for you. But thank you so much for your question. And thank you for your answer, Dr. Hasan. Another guest asks a two-part question here. The first question is, hello, thank you, Dr. Hasan, for the incredible information. I want to ask about what is the best database for collecting the literature before starting the SLR. Okay. Best database for collecting the literature.
It depends. Like if you are comparing the treatments like drugs, so best is the Cochrane Central. So then you can go for a specific, because usually they compare in clinical trials. So there is a separate option for looking at the clinical trials. Or if sometimes we are interested in qualitative research, or sometimes original research or observational research. So it depends on the type of research or study design. It depends on if you have a proper PICO model, then there are databases like Cochrane Central, PubMed. You can use PICO model, patient, the intervention, comparator outcomes. And then if you have that information, you can go and just search on PubMed as well with your PICO model. You can use Cochrane Central as well. And then one more thing is that you should go to Cochrane Central to see if there is any Cochrane review available or not on the topic, the same topic. So there is an option. There is a separate section on systematic reviews as well. You can go and search if there is any similar systematic reviews. You go and check Prospero records as well, if anybody have registered any systematic review on the similar topic. And then you go to, first is Prospero. After Prospero, you go to Cochrane Central, check for systematic reviews, and then you go PubMed. And then you can find enough information to decide whether there is a need for a new systematic review, on that particular topic.
Okay, great. Thank you for your answer, Dr. Hasan. I just put a couple of links into the chat. There's a link to Prospero for our guests there, and also a link to Cochrane for those who are interested in exploring the resources that Dr. Hasan just mentioned. The second part of that question from our guest was, when you mentioned about AI, how much of the percentage in the full manuscript should be before submitting to the journal? Okay. How much of the percentage of the full manuscript should be before submitting to the journal, if I'm reading that correctly.
Yes, now it's a big debate. Even in because I checked all the big journals, Lancet, JAMA, everyone. So there is no percentage. Nobody actually mentioned about the percentage, and it's very difficult to set a percentage a threshold of 80% or 70%. It's very difficult. So what we see is like in case of introduction or summarizing the synthesis initial part, a lot of authors they use to summarize something or condense something because you have written, for example, 1500 words, you want to condense it to 800. So is a lot of journals they accept, and then you put a statement that you have used to reduce the word count. But what we don't encourage is the use of AI in writing methods or analysis part or critical part, for example, the quality assessment, or when you're writing about the critical appraisal of very important reference in your manuscript. So you don't want like 100% or even 80%. So you just restrict to different sections, and you don't include AI as an author. No journal actually accept it. And then you check. You have to mention that in your statement that you have checked everything, especially the if you have used AI in any particular section or the part of your manuscript, you have to state that you have double checked everything. So there is no cutoff or percentage that this is acceptable and this is not acceptable. First thing is the disclosure, and then second thing is editors they look at the use of the AI, in the different sections, and sometimes they don't disclose, but you can see from the paragraphs and the summaries, you can see that it's not generated by the authors, is AI generated. So is we look at the manuscript individually. So there is no set criteria that is acceptable and this is not acceptable.
Okay, thank you very much for your answer, Dr. Hasan. Thank you very much to our guest for your question. Another question from a guest here. This is from Wala, and the question is, thank you for this insightful session. I have one question. After evaluating and critically appraising the articles using the appropriate checklist, should we include studies with low quality or high risk of bias in the systematic review, or should we exclude them? I had the same question. Thank you very much, Wala, for asking that. All right, so how should we decide whether to include studies of low quality, or do we risk introducing bias when we make those kinds of judgments?
Yes, it's a very important question. Yes, so you have two options. Like people they exclude many authors if they have enough studies, they exclude, and then they only focus on good quality or high quality studies. And second option is that you can create a subgroup. You re-estimate. If you're estimating the prevalence, for example, so you can create a subgroup with high quality studies, excluding the low quality studies, and then with low quality studies, and then you can present both, so the readers they have better understanding about the high quality, low quality studies, and then they can see the in terms of accuracy as well. So first option is you remove all the low quality studies and include only the good quality studies, and the second option is you include but you make then subgroups. So the readers, they are aware of low quality studies. Sometimes they are maybe citing it in their reports and they are not aware that this is low quality study. So it's good that you create a subgroup and tell the readers that there is a subgroup evaluating based on the quality of the studies. And there is an option in software, RevMan, for meta-analysis of including and excluding studies from the analysis. So you can re-estimate your your overall summary by excluding studies, and then you can include both values, with and without low quality studies.
Okay, that's a great question. And thank you so much for asking that question. And thank you, Dr. Hasan, for lending your insights. While our guests are thinking of perhaps a final question or two, I will ask one of my stock questions that I love to ask editors, Dr. Hasan. So, what are some of the most common reasons why a submission, a systematic review, might be rejected? at evidence synthesis in Healthcare Connect? When would you decide to reject a submission? What would be some of the most common reasons?
Redundant, like somebody already published the systematic review 2 years ago, very good quality, high quality, and they just um, you can see that they have copied the inclusion exclusion criteria. You can see a lot of similarity, with the recently published articles. So I checked, like in case of H. pylori, I mentioned about, there is a global prevalence available, very high quality paper, but the data from India was not good quality. So then I accepted it because there's only 2 articles included, and she included 52 articles. So first thing is if there is any similar systematic reviews available or not. I do a search, an initial search, and see if there is any similar systematic. Second is the main method. Main criteria is the method. Their search strategy, their keywords. If they have missed any important article or RCT or anything from their search criteria, and then inclusion exclusion criteria. If there is no proper research question, sometimes they feel, not in case of systematic review, but in case of critical review and scoping review, sometimes there is no method. So it's only like subsections, subheadings, and there is no like selection of articles and how they selected the articles to include in their manuscript. So so there is no method, there is no selection criteria, or there is nothing, enough information is available. So we reject, or we ask sometimes authors to add, section if section is missing. But repetition, reproducing the same or similar systematic reviews is 100% AI or even 80% AI, and I see there is no critical thinking, there is no new information. So it's a rejection. And also the study design, sometimes they have not clearly stated. So sometimes we give the option of resubmission as a new submission, resubmit as a new submission. But sometimes we say no. If there is no, there is serious questions about their methodological approach, and then study design, research question, AI, 100% generated without any critical thinking or rigor or transparency.
I see. I see. What about number of authors? Is it? I'm sure my graduate students would be asking this because often graduate students are expected to do their research solo. Is it a red flag if there are not enough authors? There isn't a
No,
team?
if there is a single author in systematic review, no, it's not acceptable, because you need participation, at least 3 people,
Participation.
2 to 3 people. So they cross-check each and everything. So it's not acknowledgement. People say that, oh, I'm including this person in acknowledgement, but this is beyond acknowledgement. So this work means somebody has to do the search again and then get the same or similar number. They have to involved in each and every step in the method, like from checking the articles availability, duplication. They have to check all the information extracted from the articles. They have to do quality assessment. So it's a lot of work. So you cannot say that I put your name in acknowledgement. So that's not enough.
I
There's a
see.
lot of significant contribution. So one person cannot complete a systematic review because of validation, because of the reliability and accuracy of the information. Yes, they can write they can write literature review, they can write narrative review, they can write critical review. But when there is a proper method is involved, like in case of systematic review, where you need a second reviewer, second person to check everything. So yes.
A scoping review would be acceptable with one
Yes,
author?
scoping review, yes, because this one is acceptable, yes, but not in case of systematic review. I've seen this many scoping reviews with single author.
Interesting. It's fascinating. Well, we're coming to the end of our talk today, and I have one final question for you, Dr. Hasan. Given that I know that Scifiniti is a very forward-thinking publisher and all your journals are very future-focused, I guess my last question would be, where do you see evidence synthesis evolving? Given the incredible technology, we have the ability to have incredible data processing now. Where do you see evidence synthesis evolving over the next 5 to 10 years? What do you see in the near future?
When we started this journal last year, so we had a discussion with the editorial office, about this title, whether we're going to get enough manuscript or there is, enough in this area to attract authors, and create our space, because there are journals publishing. So we are providing a very unique platform, only focusing, like an expert area in this evidence synthesis. So there are a few journals available. They are like publishing original papers as well. So we see that, and you can see the number of systematic reviews people are publishing. So there is a significant growth compared to 1990s or early 2000. So a lot of people are producing, and if you look at Prospero record, there are thousands and millions of records available. So a lot of people registering. So they need a platform to publish, their unique findings and conclusions. So sometimes findings are very unique, very informative pieces, but they are not finding because they are new researchers or they don't have enough sometimes, resources to publish in good journals. So they are looking for a space to share their findings and conclusions. So I'm expecting more manuscripts. People will find about this journal and they will find a space, and then we'll accept, of course, give a space to good quality, informative pieces and share with the wider community, scientific community. Sometimes it's critical to share. Sometimes the information is, you have to publish, at a rapid speed because the information is required, especially during COVID. If you remember, people were looking for information and there was very limited info. Even for in case of dexamethasone, there was a drug later approved for the treatment of COVID in hospitals. A recovery trial was concluded in 2021 March, and they published their findings. So it took about 1.5 years to find, the definite treatment. So in that period, you need some rapid, reviews, critical reviews. You need treatment for patients. So we are providing this space for researchers to share, the interesting, informative pieces, and this is a very a unique platform in terms of the type of study design, the type of article we are accepting. So we are not accepting all the articles, original, everything. We are only focusing on evidence synthesis. So if they have, if authors, they have produced a good quality paper, so we provide this platform for them to share their findings.
That's great. And I've put a link to the journal again into the chat for all of our guests who are joining today who might want to find more about yourself and the work that you're doing and about Evidence Synthesis Healthcare Connect and find out more about the good work that you're publishing there. I wanted to thank you very much, Dr. Hasan and Saranya, for co-presenting today. I love the fact that you bring an early career researcher in. It's fantastic. And I always like to see that. And thanks to all of our guests for making time to join this event today. We hope this was informative, certainly fascinating for me. I'm already thinking about ways I can apply this to the social sciences. So thank you so much, both of you. And any final thoughts for our guests? Oh, by the way, before you do, just wanted to mention to our guests, we will share a certificate and a full link to the video recording with all of our guests. So look forward to seeing that in your inbox at this time tomorrow. Link to the video and a certificate. Any final thoughts for our guests today, Saranya or Dr. Hasan?
You already mentioned, you shared the link of our journal. So if you are doing any evidence synthesis, systematic review, any kind of review, and you are looking for a space or a platform to publish or share your findings, you can check out our journal. So we try to give, enough feedback, and support authors throughout the process, like Sharanya shared with us. So we give very useful feedback as well, and try to publish and improve the quality working with the authors. So do consider
Fantastic. Fantastic. So all of our guests joining today, feel free to check out the link and any questions. I'm sure Dr. Hasan and team would love to hear from you and field your questions. So thanks so much to our panelists, both of you, and thanks to everyone for joining. And check your inbox tomorrow, and we'll send you everything you need, certificate, link to the full video to review. Feel free to share the video with any of your colleagues, any of your lab partners, anyone. I'm sure the team would love you to share with as many people as you can. So thank you again, Dr. Hasan. And Saranya, thank you so much. And
thank you, sir. Thank you.
Thank you. And big thanks to the Scifiniti team as well. Thanks, everyone. Have a wonderful day.
Thank you. Bye.
Goodbye.